Hello, my name is Stephen Baah-Mensah, and for my cross-cultural presentation, I'm going to be doing gender-sensitive healthcare. So starting off, we have to talk about what exactly gender sensitivity is. And gender sensitivity, by definition, is the process by which people are made aware of how gender plays a role in life throughout their treatment of others. So in simpler terms, gender sensitivity or being gender sensitive is taking the gender of the person or people that are being cared for into consideration and using that information to potentially alter how you care for them based on whether their identity is that of a male or a female. And so what do we mean by what do we mean by gender sensitive healthcare? Gender sensitive healthcare is pretty much referring to the knowledge or understanding of the differences and inequalities and varying needs of the gender identities, that being male, female, or other. And to break that down, I have a video here for us to watch.
3 years. Almost a year.
7 years.
8 months.
I went 16 years before I was properly diagnosed.
I went 10 years in pain before I was diagnosed.
The first symptom was a sharp stabbing pain between my shoulder blades that felt like an ice pick. My abdomen was just getting bigger and bigger, and it was hard.
My skin turned yellow, my eyes turned yellow.
I almost felt this feral level of fear because I'd never experienced a pain so mysterious and profound like this. With every step I took, I was just at level 9 pain.
My chest was hurting, I'm sweating, my jaw was killing me.
The pain, the cramps, having to run to the bathroom all the time.
Oh, I was so discouraged. My symptoms just kept getting worse.
I'm not eating anymore. I can't sleep anymore.
I was told that I was a female who was looking for attention and that they see no sign of anything else wrong with me except for maybe it was in my head.
I was told that I was crazy.
Sometimes I was told I was lazy. Sometimes I was told I was unmotivated.
Being told there was nothing wrong with me, that I was just going to have to get used to my ever-expanding belly, that I had IBS, and I was just obese.
I was told that I was experiencing psychosomatic pain stemming from guilt for sinning with boys.
So he said, maybe this is just anxiety. I think you're just having anxiety and, you probably need to see a psychiatrist.
I came to Cedars-Sinai for a second opinion.
So if I hadn't come to Cedars-Sinai, I know 100% that my diagnosis would not have been found. I was diagnosed with autoimmune hepatitis.
About 3/4 of the way through the appointment, she looked at me and told me, "We know what you have, we know how to treat you, and you're gonna get better." And I looked at my husband and I just started to cry.
I was told the news that would sort of change my life forever. And they said, "Ms. Garcia, you have a mass." I had a 25-pound ovarian tumor. So it was not IBS. And that's when I found out I had cancer.
I was diagnosed with endometriosis that my surgeon had said was one of the worst cases of endometriosis in a young person she had ever seen in her career.
I was diagnosed with microvascular heart disease. I was diagnosed with a 97% blockage and a 94% blockage in left and right coronary arteries.
I was diagnosed with IBS with SIBO. And he says, "Honey, it's your arteries. It's just small arteries like I suspected that are not functioning properly." I feel like finally someone listened. Finally, I was somewhere where they cared, where they listened. As a woman, you need to listen to your own body.
You need to be your own advocate.
If you need help, don't be afraid to ask for it. It's okay.
Get a second opinion, a third opinion, a fourth opinion.
Don't give up.
Don't ever give up. And don't take no for an answer.
I was shocked and surprised at the disparity between how men and women are treated. And I was just so pleased to find out that Cedars-Sinai is trying to bridge the gap in women's health.
I'm delighted that there are teams of brilliant people doing studies, doing research. It's vital. It's just very important. Very important.
All right. So that video right there that I just shared kind of gave an inside look of the effects that having gender insensitive care, I guess you could call it, has the effect that that has on women. And we'll go deeper into that as we go further into the presentation. So some of the dangers of having gender bias in healthcare are some of these three things right here, which are cardiovascular disease, mental health, and pain management. Uh, so without adequate care to optimize the awareness of gender, this has a huge impact on the health and the effect of and the effects of presenting the health complications that come with this. This sensitivity allows health professionals to deal effectively with gender, which will have positive effects on men as well as women. So going into the dangers, cardiovascular disease, we see heart attack being the leading killer in American women. So for just about 100 years, the mortality rate of heart attacks has been far greater in women than that of men. And studies show that there are no real physical reasons for why women die at higher rates from heart attacks and cardiovascular diseases than men. In fact, a study done by the Journal of American Heart Association found out that women receive the same therapies that men do, and their odds of survival are the same. So with that being so, we can assume that the increased danger lies for women as a response to heart attacks. And another thing that makes a huge danger in terms of cardiovascular diseases are that women display different symptoms for heart attacks than men do. For example, in a woman, the symptoms for a heart attack are often less painful and less alarming than that of in a man. And cardiovascular health is not the only specialty in which genders are treated differently. Mental illness is also a discipline where gender bias is becoming very apparent. So according to the WHO, the overall rates of mental disorders are almost identical for men as they are in women, but there are striking gender differences in the patterns of mental illness. Just like cardiovascular disease, we see that men and women are treated the same for mental health issues, but it should not be so. Should not be treated the same at all. And the WHO also pointed out that women are more likely to be treated for depression than men, even though the rates of depression do not differ quite at all between the genders. That just goes to show that these two genders cannot be treated similarly because they just respond differently and show different symptoms for very similar diseases. So we find that it's very important for medical professionals to screen both men and women for mental health disorders to make sure that the patients receive appropriate treatment for their diseases and not falsely diagnose women because they're treating them and actually giving them treatment that is meant for men. Pain management is also an area where women are not taken nearly as seriously as they should be by some medical professionals. And the treatment for pain differs greatly between the genders. We see that women dominate most diagnoses related to chronic pain, and the research constantly shows differences between sexes, like the perception of pain and the description and the expression of the pain that they're feeling. However, more research is needed for women's conditions such as polycystic ovarian syndrome, which is pretty much when the levels of androgens get very high and many small cysts develop on the ovaries, or as well as a condition which is endometriosis, which was featured in the video before, which is a disorder where the tissues that are usually lining the uterus grow outside of the uterus. But the way that medical providers perceive the complaints, the way they perceive the complaints from the both genders need to be addressed very closely. So going forward, the two countries that I decided to compare were the United States and Egypt. And I focused primarily on the prenatal care and childbirth between the two countries. In America, we see that the health needs are significantly greater among older women compared to men, but women have much fewer economic resources. Surprisingly, we see that the US has the highest maternal mortality rate amongst the developed countries. The US also has a relative undersupply of maternity care providers, which with that lack of postpartum support really results in negative facts that I have here to share. Women in the US are more likely to die from complications related to pregnancy or childbirth, which the way our country is set up and the advancements that we've made just should not be a thing at all. A stat I have here to share is that in 2018, there were 17 maternal deaths for every 100,000 live births in the US. And that's a ratio more than double that of most of the high income countries. In contrast to that, the maternal mortality ratio is 3 per 100,000 fewer in the Netherlands, Norway, or New Zealand, for example, other big countries. And another extremely shocking fact is that the US, along with Canada, have the lowest overall supply of midwives, which is just insane to think about considering those two are some of the most heavily populated countries around the world. the US having almost 12 providers per live births and Canada having around 15. And most countries have up to 6 times that much of midwives to help with maternal duties and stuff like that. In Egypt, we see that the prenatal care and childbirth that that country deals with are a lot better than I personally thought it was going to be. Between the years of 1995 and 2014, the percentage of women delivered in health facilities increased from a shocking 35% to a much, much better 87%. Women delivered with a skilled birth assistant increased from 49% to 92%, and that's during that same period of time. The percentage of women delivered in a private facility almost quadrupled from 16% to 63% in 2010 and up until 2014 when this sample was taken. Fewer than 2% of women delivered in public areas, which was just an incredible stat because Egypt really, really struggled with having their mothers being educated enough to go in to see a professional to have their birth done, or in some cases just didn't even have the facilities to do so. There weren't these places put out and encouraged to take advantage of by their economy and stuff like that. Um, so here we have some psychocultural factors that contributed to the issue in Egypt specifically. The Egyptian government spent only just under 5% of its GDP on its healthcare system, which is severely, severely underfunded, and cause for people like the Egyptian mothers and Egyptian women to not be able to access things like education, care, and support for their reproductive, sexual, and maternal health. And this unfortunate cultural elements that have significant gap between women's access to healthcare and males' access to healthcare. However, the healthcare providers needed improvement, and due to most women not seeking medical attention that was available, most women were not even educated enough on the reproductive health to have significant presence on the reproductive issues that we see that they face. Many believe that as long as they were able to have children, they would be fine, despite the painful symptoms that would come with obviously bearing a child and going through those kicks and stuff like that their child will do to them. Um, so according to research in Jordan, most women feel more comfortable being treated by female doctors, and many believe that the increasing amount of female doctors in Egypt will actually allow for women to seek treatment greater, which is obviously a great, great thing. So some factors contributing to why there is gender sensitive healthcare are some things like the demographics. For example, in Egypt, the access of women's healthcare is unequal across the nation. You have places like Upper Egypt and Lower Egypt having different opportunities to reach these facilities to get help, such as the lower part of Egypt being a lot more wealthy and a lot more of an urban region, whereas the upper part of Egypt being far more rural and having a much more poorer population. The geography of Egypt obviously had a big role to play with being located next to the Nile River and places such as that. The economics, looking at the US, economic factors played into this. In 2007, the healthcare spending reached almost $2.3 trillion. That right there is a lot of money that can be put towards good, that can be used to push the agenda of promoting gender sensitive healthcare. And seeing a number like that really makes me think that, like, why were stats such as like US having the greatest maternal deaths such a thing, and when there's so much money being pumped into these industries such as healthcare. Some societal factors that play into both of the countries were that obviously society was dismissing things like women's pain, and believing that, they just needed to tough up and things like that, and not actually considering their symptoms to be anything other than what they might have in the book, as well as educational factors that go into gender sensitive healthcare, such as women not being educated on them having varied symptoms for very similar, if not the same, diseases that a man might go through, such as women having the different symptoms for a heart attack. Um, Obviously, those women need to be educated themselves to understand that a woman's symptoms for heart attacks are much different than that of a man, and they must be able to pick these out and understand that, like, yeah, I'm potentially having a heart attack right now, and being able to go from there. So some things that can be done by a bunch of different groups. Us as individuals, we can begin to recognize that there's gender bias, or that there needs to be gender bias in our care. The first step is to acknowledge that there is gender bias, of course, and it is imperative for the patients to be aware of the gender bias in the healthcare, and we must go to try and rectify these biases. Um, so the higher ups in the government and local organizations need to be conducting more research involving women to find more ways to properly properly diagnose them for varied diseases that they might be experiencing, and not just rely on all the tests they've done on male symptoms and on these diseases, ensuring that women are properly represented in the medical research and help to alleviate gender bias. And as big as it can go, the global organizations like the WHO and put things, big organizations such as that need to go on to promote education of these places to healthcare professionals, such as the doctors and people that we go and take ourselves when we are feeling sick, or like something's coming on, or experiencing these varied symptoms. So to summarize, gender sensitivity is a process of which people are being aware that gender plays a role in our life and the treatment that we need to get. And that's pretty much determining that whether you're a man or woman, you need to be treated differently because you're a man or a woman. And there's obviously great dangers that come with not being treated separately in our ways of care. There's obviously very severe effects that can come from cardiovascular disease, mental health, as well as being able to manage pain. We saw that America and Egypt actually were fairly similar in their prenatal care, despite America obviously being one of the most developed countries on the planet, and Egypt being far less developed in Africa and having a lot less funds than America does, of course. And then we looked at a bunch of the the social factors that contributed to gender sensitive healthcare, which were things such as the geography of Egypt being located by the Nile River, or societal factors that go into both countries, like society dismissing a female's perception of pain and things like that. And then we looked at some of the things that we can do as individuals or as local organizations or as high as it goes by going on to just individually in individually recognize that there is a problem and then work up to having the big dogs go on and inform everyone and inform the professionals that go on to inform their patients about ways to rectify the gender insensitive healthcare that we experience. So, in conclusion, we see that gender sensitive healthcare is something that definitely needs to be looked at. It has an impact on our health and affects the presentation of health complaints. And this sensitivity allows for health professionals to deal effectively with the gender and have positive effects on men as well as women. As simple as that may sound, to take care of people more specifically based on their gender, it is hardly practiced and is responsible for harming or killing several women across the world. Right here are my many references, and thank you for watching my presentation. Thank you.